Hi, I'm Leonie, a women's health physio and pregnancy Pilates instructor. This series is designed to help you move safely during pregnancy, build strength, support your pelvic floor, and more importantly, some much needed release. Before we start, please always listen to your body and consult your healthcare provider if you are unsure. Let's get moving. Before starting this series, it's important to understand our pelvic floor muscles and their connection to our breathing muscle, the diaphragm. So our pelvic floor muscles are a group of 12 muscles that sit at the base of our pelvis, and they are there to support our pelvic organs, our bladder, our uterus, and our bowels. Our deep core muscles wrap around our abdominal cavity, or abdominal wall, and our diaphragm is the big breathing muscle that sits at the base of our rib cage. When we have good coordination of our breathing, we breathe in through our nose, down into our lungs, and our diaphragm lowers down to bring more air into the rib cage. Because we have tummy contents, it's got to push those tummy contents out of the way, and it asks that deep abdominal muscle to relax and expand, and asks that pelvic floor muscle group to relax and lower to allow more room. We breathe back out, the diaphragm pushes back up to push the air out, and it simultaneously asks that deep core muscle and pelvic floor unit to lift up and contract to help push that air back out. So as we are breathing in and breathing out, that diaphragm, pelvic floor, deep core unit just works in unison together. So in Pilates, we work on the coordination of that muscle unit. All right, we're going to roll down again, so chin to chest, rolling down. This time we can walk out, we can bend the knees and bring ourselves out onto our hands and knees, 4-point position in the middle of the mat. So hands are hip width, shoulder width apart, knees are hip width apart. We just want to make sure that we're not really sinking and dropping down through our lower back. We're going to try and keep that tailbone tucked under a nice long spine. And from here, we're going to go into some mobility. So our hip circles are turning those hips out and around, just loosening them off. 3, 4, and 5, and changing direction. 1, 2, 3, 4, and 5. And then from there, we'll just come back into the middle. We're going to go into some cat-cows. So tailbone draws under, bringing baby back into spine as we roll up to arch the spine down to the head, and then turn the tailbone back the other way to allow the back to arch all the way up through the middle back to our head, and tucking that tailbone, rolling around, bringing baby back towards spine. And back the other way. Just breathing and releasing as you go. 2 more here. And last one. Good, and come back into the middle, and we're going to go into our thread needles. So we're going to do 5 on each side. We're going to put the right hand between left hand, left knee, slide that hand out along the floor to twist through that upper back. Big breath out and coming back through, and same again for 2. We're going to sort of bend in through that supporting arm, waking that shoulder blade up as well. 3, 4, last one on this side, and then we're going to the other side. Breathing in, breathing out. 2 more here. And last one. Now we're going to take those knees as wide as the hip, as wide as the mat. Sink our bottoms back to our heels. Allow those arms to drop down, dropping that forehead onto the mat. We're stretching here, but we're going to go through 5 deep diaphragm breaths. Breathing down into the belly, making the belly go fat. And breathing back out. Good. Well done. I hope you're all feeling much more relaxed. If you enjoyed today's class, then please make sure you check out my other videos in this Pregnancy Pilates series. And you can also find more resources over on my website linked below. And please feel free to come and say hi on Facebook or Instagram. Thank you for moving with me today. I will see you all in the next video.